Hi, I'm Dr. Obermeyer, and the purpose of this video is to review some of the common top-of-mind concerns for patients considering shoulder replacement surgery, such as how much pain will I experience, how much physical therapy is needed, how does the sling work, and how does this surgery impact my day-to-day activities. Shoulder replacement surgery typically takes about an hour to perform and is done most commonly as an outpatient, where the patient leaves the surgical facility the same day. One of the strategies for mitigating pain after the procedure is a numbing nerve block that is administered by the anesthesiologist into the neck area that helps to serve to numb the shoulder for a period of typically around 18 to 24 hours following the procedure. Once the numbing nerve block starts to dissipate, the pain typically sets in and usually requires an oral narcotic pain medication that's taken on a scheduled basis, meaning every 4 to 6 hours for the first day or two, and then as needed. And this medication is typically continued for approximately 1 to 2 weeks following the surgery. Some other adjuvant or helpful types of secondary medications that can also help for the first few weeks include anti-inflammatories such as Celebrex, ibuprofen, Aleve, or naproxen. And these can help to minimize the pain and help to limit the burden or requirement for oral narcotic pills, which have a more unforgiving side effect profile. Although a sling is worn typically for about 4, if not 6 weeks following the replacement, early activities can be initiated sometimes the day of or the day following the procedure with the hand in front of the body for simple activities such as feeding oneself, working on a computer or a cell phone, or using the hand for simple activities that do not involve big hand positions or reaching and positioning the arm away from the body. Within a day or two following surgery, the sling can be removed a couple of times a day for early range of motion of the hand, wrist, elbow, and gentle shoulder exercise. Typically, this consists of removing the sling and letting the arm dangle at the side and initiating gentle dangling type exercises with the shoulder known as pendulums. At this time, the elbow can be moved with bending and straightening, and the hand and wrist can be moved, and gentle grasping or gripping activities can be initiated with the hand. At approximately 2 weeks, driving can be initiated, which typically coincides with the initiation of outpatient physical therapy that can be performed 2, if not 3 times a week for early range of motion exercise that protect the shoulder replacement but allow the shoulder to start moving to improve and optimize the recovery of mobility. Once the sling is discontinued at 4, if not 6 weeks, depending on the type of surgery and your specific problem, early activities of daily living and reaching and full simple daily use of the arm can be initiated, including getting the arm overhead as one tolerates. Between 6 and 12 weeks, when the sling is off and the patient is using the arm for unrestricted daily use, range of motion is continued to be emphasized with physical therapy with light resistive exercise or strengthening that allows the shoulder to continue to improve its function. Typically, around 3, if not 4 months following surgery, the patient can resume simple recreational exercise or activities, including things like golf, that is initially pursued with, for example, chipping and putting, and then progressed so that by around 5 to 6 months, the patient can take a full swing with full active use of the arm. Similarly, value leisure activities such as pickleball can be reinitiated around 3, if not 4 months, depending on the patient's progress. Most of the time, physical therapy is discontinued by around 3 months following surgery, at which point milestones are achieved, such as lifting a light object overhead without any undue strain by the patient. Important improvements can continue to be made for approximately 6, if not 9 or more months following surgery, and this coincides with the recovery of more ambitious activities, including things like singles tennis and overhead freestyle type swimming. Most patients can undergo shoulder replacement that live alone, although it does help to have someone to help for the first few days following surgery with simple daily activities and as one adjusts to the use of the sling. Making simple modifications such as wearing slip-on shoes, sitting in an upright or semi-recumbent position with the arm propped at the side for a few weeks can also be helpful. There are some real risks following surgery. However, things that are very feared, such as infections, are very uncommon in a patient with well-managed medical comorbidities. And typically these types of devastating complications are seen very rarely at less than 1%. Things like wearing out of the implant is rarely seen with modern implant designs. And if one were to require further surgery, which admittedly is very uncommon, This would be a result of other prosthetic or soft tissue related complications surrounding the implant itself, and not a result of failure of the device used for the shoulder replacement. Despite these risks, the vast majority of patients, including more than 90 or 95% of individuals, will experience oftentimes life-changing improvements in their pain, function, and ability to use the arm for daily and recreational use. Thank you for your interest in shoulder replacement recovery, and please review our website for more information.